Welcome to the deep dive. Today we're really getting into something that, well, it affects millions of people across the globe, often silently. We're talking about gluten, celiac disease, and this huge rise in gluten-free living.
Yeah, it's fascinating.
We've gathered a ton of research, and we're hoping to help you cut through some of the noise around this topic.
It really is fascinating because it pulls together so many different areas, doesn't it? You've got genetics, immunology, gut health, even like social and economic factors playing a role.
Exactly.
So our mission today really is to explore the science behind these gluten issues, look at what going gluten-free actually means for different people, and maybe peek at what's coming next. Hopefully you walk away feeling, properly informed.
Okay, so let's start right at the beginning. Gluten. What exactly is it? We hear the term constantly.
Right. Well, technically, it's a mix of proteins, gliadin, and glutenin found mainly in wheat, but also barley and rye. The name itself comes from Latin, meaning glue.
Glue, huh? That makes sense.
It really does, because that's its unique feature. It forms this stretchy, kind of elastic network in dough. Bakers call it a viscoelastic network.
Okay.
And that's what gives bread its texture, its chewiness. It holds things together. Super important in food processing.
Got it. So it's not just one thing when people react badly to gluten, is it? The research suggests more of a spectrum.
That's spot on. Our sources bring it down into three main conditions. First up, and probably the best known, is celiac disease. CD.
Right, celiac.
This is an inherited autoimmune disorder. So your immune system basically gets confused and starts attacking your own tissues.
Not just an intolerance then, it's an attack.
Exactly. An attack triggered by gluten in people who are genetically susceptible. And it affects about 1% of people globally, maybe more, as we're seeing it diagnosed more often.
Wow, so what does that attack actually do?
It damages the lining of the small intestine. Imagine the inside of your gut is lined with these tiny finger-like things called villi, like a carpet. They're crucial for absorbing nutrients. In celiac disease, these villi get flattened out. It's called villus atrophy. So that plush carpet becomes like a flat, hard floor.
Making it hard to absorb food properly.
Precisely. Nutrient absorption goes way down. And the symptoms, well, they can be all over the place.
Like what? Is it just stomach issues?
You definitely get the classic gut symptoms. Diarrhea, sometimes constipation, weight loss you can't explain, bloating, stomach pain, that kind of thing. In kids, it might show up as poor growth or irritability.
Okay.
And this is really important, it often goes way beyond the gut. We call them extraintestinal symptoms. Things like chronic fatigue, anemia because you're not absorbing iron or B12, headaches, muscle weakness.
Wow, really?
Oh, yeah. Nerve tingling, joint pain, bone problems like osteoporosis, even infertility or issues with pregnancy. It can be incredibly widespread.
That sounds really tough to pin down then with such varied symptoms. How do doctors figure it out?
It usually starts with blood tests. They look for specific antibodies, mainly one called tissue transglutaminase IgA or TTG-IgA.
TTG-IgA, okay.
But here's the catch, and it's a big one. You have to be eating gluten for these tests to be accurate. If you've already cut out gluten, the test might come back negative even if you do have celiac.
Ah, the gluten challenge. I've heard of that.
Exactly. You usually need to eat gluten for a few weeks before the test. If the blood test is positive, then the gold standard for confirmation is an endoscopy with a biopsy. They take a tiny sample from the small intestine to look for that villus atrophy under the microscope.
Right, so that confirms the damage.
It confirms the damage. Now, the second condition is non-celiac gluten sensitivity, or NCGS. This one's thought to be much more common than celiac, maybe affecting up to like 13% of people in some estimates.
13%, that's huge.
It is, but it's also trickier. Unlike celiac, NCGS doesn't seem to cause that major intestinal damage, the villus atrophy, the immune system is involved, probably the innate part, but we don't have a specific test, a biomarker for it yet.
So how do you diagnose it then, if there's no test?
That's the challenge. It's really a diagnosis of exclusion. You rule out celiac disease, you rule out wheat allergy. Then, if symptoms get better on a gluten-free diet and come back when gluten is reintroduced, that points towards NCGS.
And the symptoms, similar to celiac.
Often, yes. Gut issues like bloating, pain, changes in bowel habits, but also the non-gut stuff. headaches, that feeling of brain fog, fatigue, sometimes mood changes, or even skin issues.
Brain fog, yeah, I hear that a lot.
It's a common complaint, and there's some newer research looking into other components of wheat, not just gluten, like proteins called ATIs, alpha-amylase trypsin inhibitors.
Yeah.
They might be involved in triggering inflammation in NCGS, but we still need more solid human data on that.
Interesting. Okay, so celiac, NCGS was the third one.
The third is wheat allergy. This is a completely different beast. It's a classic IgE-mediated allergy, like a peanut allergy, but to wheat.
Ah, so a quick reaction.
Very quick, yeah. Usually within minutes to maybe an hour or two of eating wheat. Symptoms are typical allergy symptoms. Hives, swelling, itching, maybe digestive upset, congestion. And in severe cases, it can cause anaphylaxis, which is life-threatening.
But it doesn't cause that long-term gut damage like celiac.
No, exactly. It's an acute reaction, not a chronic autoimmune process damaging the gut lining. 3 distinct things, all related to gluten or wheat, but very different mechanisms and consequences.
That's a really helpful breakdown. So let's dig into celiac disease a bit more. Why do some people get it and not others? You mentioned genetics.
Yes, genetics are absolutely fundamental here. Our sources are clear. Almost everyone, like 99% of people with celiac disease, carry specific genetic markers. They're called HLA-DQ2 and HLA-DQ8.
Okay, HLA-DQ2 and DQ8. So if you have those genes, you'll get celiac disease.
Ah, see, that's where it gets interesting. No, not necessarily. Well, you almost always need those genes to develop celiac disease. Having them doesn't guarantee you'll get it. In fact, something like 20–30% of the general population in Western countries has these genes but don't have celiac disease.
So the genes are necessary but not sufficient.
Exactly. They're an indispensable prerequisite, as one source put it. You need them, but you also need other things, likely other genetic factors we haven't fully mapped out yet, plus environmental triggers. We don't know exactly what all the triggers are. Could be infections, stress, other factors.
How do those HLA genes actually work in celiac disease?
So these HLA molecules sit on the surface of certain immune cells called antigen-presenting cells. Their job is basically to show bits of proteins, antigens, to other immune cells, like T cells, to check if they're friend or foe. In people with DQ2 or DQ8, these molecules are particularly good at grabbing onto certain fragments of gluten. Specifically gluten that's been slightly modified by an enzyme in the gut called transglutaminase. When they present these modified gluten bits to T cells, the T cells mistakenly see them as dangerous invaders.
And then it kicks off the attack.
That kicks off the whole inflammatory cascade and the attack on the gut lining. And we definitely see the genetic link in families. If you have first-degree relative, a parent, sibling, child with celiac, your risk is significantly higher, around 7.5%.
Wow.
And identical twins. If one has it, the chance the other will develop it is over 70%. That's a huge concordance.
That really underscores the genetic part.
It does. And there's another layer. Some people inherit 2 copies of the main risk gene, HLA-DQ2. That's only about 2% of the population, but they make up about a quarter of all celiac patients and often have more severe disease.
Interesting. And does this vary globally?
Massively. Celiac disease is extremely rare in places like Japan, and that lines up perfectly with the fact that the HLA-DQ2 gene variant is very uncommon in the Japanese population.
Fascinating.
Then you look at somewhere like South Africa. The research there shows that the risk genes, HLA-DQ2.5 and HLA-DQ8, are actually quite common overall, about 20% prevalence. But it differs between ethnic groups.
How so?
They're less common in Black South Africans compared to white South Africans, but, and this is critical, they are present in Black populations, meaning celiac disease absolutely occurs in Black South Africans. It's really important to counter that old, incorrect idea that it's only a disease affecting people of European descent.
That's a really crucial point to make. Okay, so genetics lays the foundation.
Yeah.
What else is in the mix? Our research pointed strongly towards the gut microbiome.
Yes, the gut microbiome, that bustling community of trillions of bacteria and other microbes living in our digestive tract. It's become increasingly clear that the health and balance of this community, or lack thereof, plays a role in loads of health conditions.
Including celiac disease.
Including celiac disease. The term often used is dysbiosis, which basically means an imbalance in the gut microbes. Studies have found differences in the gut bacteria of people with celiac disease compared to healthy controls.
What kind of differences?
Well, it varies a bit between studies, which tells you how complex this is. But common findings include lower levels of some beneficial groups like bifidobacteria and bacteroidetes, maybe lower overall microbial diversity or richness.
So an unbalanced gut environment seems linked to celiac. Does going gluten-free fix that?
That's the million-dollar question, isn't it? It's complicated. Some studies suggest that adhering to a strict gluten-free diet can lead to positive changes in the gut microbiota composition and function in people with celiac disease. As the gut lining heals, maybe it creates a better environment for certain beneficial bacteria to thrive.
Okay, so the diet helps the gut heal, and the microbiome improves.
Potentially. But the findings are, again, a bit inconsistent. And even when improvements are seen, getting the microbiome back to a fully normal state can take a long time, sometimes over a year, especially in children.
And then there's this other kind of counterintuitive idea floating around. Some researchers propose that avoiding gluten long-term might itself cause issues for the microbiome in some people. Because gluten-containing whole grains often come with beneficial fibers that feed gut bacteria. Removing those might paradoxically contribute to ongoing dysbiosis for some. Wow, so the diet that treats the disease might also affect the microbiome in complex ways.
Exactly. It highlights just how much more we need to learn, especially from long-term studies tracking people over time. And interestingly, for non-celiac gluten sensitivity, NCGS, there is a hypothesis that dysbiosis might actually be part of the cause, perhaps involving specific changes in bacteria that produce important substances like butyrate.
Fascinating. Okay, so we've established that for diagnosed celiac disease, the gluten-free diet is essential. It's the treatment.
Absolutely. Strict lifelong adherence is currently the only effective medical treatment.
But then there's this massive trend of people without a diagnosis choosing to eat gluten-free. What's driving that?
That's a huge phenomenon. Consumer surveys show really significant numbers, like a third of Canadians, over a quarter of Americans believe gluten-free products are just healthier, full stop.
Healthier for everyone.
That seems to be the perception for many. They adopt it for general wellness or sometimes for weight loss, even though there's really no good scientific evidence to back that up. For people who don't have celiac disease, wheat allergy, or NCGS.
It's that health halo effect, maybe.
Precisely. People who value gluten-free often also value other things they see as healthy, organic, natural, locally grown, not processed. And while some studies show these individuals might have some markers of a healthier diet overall, there's also a concerning link. Some research suggests that people strongly valuing gluten-free are also more likely to engage in unhealthy weight control methods, like using diet pills or even vomiting, which is obviously not good.
That's worrying.
It is. The bottom line for most people, the vast majority, is that gluten itself isn't harmful. They can eat it without any problems.
Okay, so for those who do need to be gluten-free for medical reasons, what are the actual nutritional implications? Is it just a simple swap?
Oh, definitely not a simple swap. This is a really critical area. When you take out wheat, barley, and rye, you have to replace them with something. Gluten-free products often rely on things like rice flour, cornstarch, potato starch, tapioca starch.
Right.
And nutritionally, these replacements often lead to products that are higher in fat, higher in sugar, and higher in sodium compared to the original gluten-containing versions.
Okay, really?
Yes. For example, our sources mention gluten-free breads can easily have twice the fat content of regular bread, and they're often lower in protein and, importantly, dietary fiber.
Lower in fiber, that's a big one.
Huge. And another major issue is fortification. Standard bread, pasta, cereals are often fortified with essential vitamins and minerals, things like B vitamins, folate, niacin, thiamine, riboflavins, and iron.
Right, you see that on the labels.
Exactly. But many, they really are, consistently 2 to 4 times more expensive than their regular counterparts, according to the research. And sometimes that price gap is even wider at, say, budget supermarkets compared to upscale ones.
Wow, 2 to 4 times. That adds up incredibly fast.
It absolutely does. And this leads directly to issues of food insecurity for some people on mandatory gluten-free diets. One study from the Netherlands found almost a quarter of participants reported having trouble affording the gluten-free foods they needed, which in turn impacted their overall diet quality.
That's awful, having to choose between sticking to your medically necessary diet and affording food.
It's a terrible position to be in. Then there's the issue of availability and hidden gluten. Eating out can be a minefield. Social events can be stressful.
Worrying about cross-contamination.
Constantly. And hidden gluten can lurk in processed foods, sauces, dressings, even medications and supplements sometimes. It means constant vigilance, reading every single label, looking for that certified gluten-free mark.
That sounds exhausting.
It creates a huge mental load, as researchers call it. Just the constant thinking, planning, checking. It can lead to significant stress, anxiety, feeling isolated when you can't eat what everyone else is eating. Some people even report skipping meals altogether sometimes, just to avoid the risk and the hassle.
Skipping meals.
Mm.
Wow. That really paints a picture of the burden and navigating all this. You'd hope people get good guidance, right?
You would hope so. But here's another gap the research highlights. A startlingly high number, 60% in one survey across different income levels, said no healthcare professional had ever properly educated them about gluten or how to follow the diet.
60%. So they're left to figure it out themselves.
Largely, yes. Relying on Dr. Google, online forums, trial and error, which can lead to ongoing confusion and gaps in understanding, even about the basics of their own condition.
That really needs to improve.
Yeah.
Okay, so given all these challenges, but also the perceived benefits driving the trend, what's happening in the gluten-free market itself? You mentioned it's huge.
It is enormous. We're talking billions globally. One estimate put it at over $7.7 billion US in 2024 and projected to grow to well over $13 billion by 2030. That's a compound annual growth rate of 10%.
10% growth. That's massive. North America is the biggest market.
Currently, yes. And the drivers are partly the genuine rise in celiac diagnoses, but also this broader consumer demand for foods seen as supporting digestive health, catering to intolerances, real or perceived, and offering those perceived health benefits. Demand jumped 16% globally just between 2018 and 2022.
Are companies innovating in this space?
Yeah.
Trying to make better products?
Oh, definitely. There's a lot of innovation. Companies are forming partnerships to focus on sustainable allergen-free options. We're seeing new recipes, even patented dough technologies trying to replicate the texture and taste of traditional bread, which has always been a big challenge for gluten-free baking.
Trying to bridge that gap.
Exactly. But there are also signs the market might be perhaps starting to plateau slightly, or at least the explosive growth phase might be cooling.
Oh.
How so? Some data suggests a decline in the number of new gluten-free product launches, and maybe waning interest among consumers who are just trying it as a fad diet.
Yeah.
The sort of marketing wow factor might be peaking a little.
Interesting. So maybe a bit of a market correction happening. Let's shift back to the medical side. For people with celiac disease, stuck with this really burdensome diet, what does the future hold? Are there treatments being developed beyond just avoiding gluten?
Yes, and this is where things get really exciting. There's a huge amount of research going into developing actual therapies for celiac disease. Because you're right, the gluten-free diet, while essential, isn't a cure. And accidental gluten exposure is incredibly common.
How common?
One study found nearly 73% of Americans medically diagnosed with celiac reported accidental exposure within the past year. And for most of them, that leads to symptoms returning gut issues, neurological problems like brain fog or headaches, psychological distress. It's a constant risk.
So new therapies could potentially protect against that exposure.
Or even allow more diet flexibility. That's the goal. And several promising strategies are already in clinical trials, mostly phase 2 right now. These aren't science fiction. They're being tested in people.
Okay. What kind of approaches are we talking about?
Well, one idea is enzymatic degradation, basically developing pills containing enzymes that break down gluten peptides in the stomach and small intestine before they can trigger the immune reaction. Things like lataglutenase or TK062 are examples being tested.
So like a digestive aid specifically for gluten.
Kind of, yeah. Another approach targets the gut lining itself, tight junction regulation. Gluten can increase intestinal permeability or leakiness in people with celiac. So drugs like Larazotide acetate aim to tighten those junctions back up, reducing symptoms, though results in actually fixing the permeability have been a bit mixed so far.
Okay, what else?
And then you get into the really cutting-edge stuff, immunomodulation and trying to induce tolerance. These are strategies trying to fundamentally change the immune system's response to gluten.
Re-educating the immune system.
Exactly. So there are approaches using nanoparticles carrying gluten fragments to try and teach T cells not to react. There are therapeutic vaccines being developed. There are monoclonal antibodies designed to block key inflammatory signals, like a molecule called IL-15, which is crucial in driving the damage in celiac disease.
Wow, that sounds incredibly sophisticated.
It really is. One more category. Transglutaminase inhibitors. Remember that enzyme that modifies gluten?
Yeah, the one that makes it trigger the immune cells?
Right. So drugs like ZED1227 aim to block that enzyme, preventing that crucial modification step. Early results suggest this can lead to better healing of the gut lining and less inflammation.
So a whole range of potential new tools coming down the pipeline.
A whole range. It's genuinely hopeful. The aim isn't necessarily to completely replace the gluten-free diet overnight, but to offer therapies that could protect against accidental exposure, reduce the burden of strict avoidance, improve quality of life, and maybe, just maybe, allow for a more flexible approach in the future.
What an incredible deep dive this has been. From understanding the proteins themselves to the complexities of celiac disease, the genetics, the microbiome,
Yeah.
all the way through to the realities of the gluten-free diet, the nutritional challenges,
Yeah.
the cost, the mental load, and now these really hopeful future therapies. It's definitely not just a simple food choice for so many people.
Absolutely. And it leaves us with a really interesting thought, doesn't it? If these new therapies do eventually offer more freedom and flexibility for people with celiac disease, how might that change the way society views gluten-free? Will that health halo finally fade, and we'll see it shift back towards being understood primarily as a medical necessity, allowing for a more balanced view of nutrition for everyone else?
That's a fascinating question to ponder. Definitely something for us all to think about.